Okay. Good afternoon, everybody. Thank you for being here. Big shout out to my friend Tom Walters here. Good to see you, Tom. Let's get into some data. Want to go over some points and address some issues that I know everybody wants to talk about. Then we'll take some questions. So we currently have 598 cases. This is up from 579 yesterday. That's 19 more cases since yesterday. To recap, we've had 17 neighbors who have lost their fight to COVID-19. Again, we're thinking about these people, we're praying for them and their families. These are situations where these individuals didn't get to spend time at the end with their loved ones, so this is very hard for their families. Today, we have 47 individuals that are in the hospital. This is representing 17% of our active cases. This number has been about between 18 and 20% of our active cases are hospitalizations. It tells you how serious this virus is. So that's down a little bit, but I think overall the 18 to 20% range will be the range for this. 22 individuals are in critical condition at this point. This is representing 8% of our active cases. This number has been really spot on. Again, if you're critical, this is somebody essentially who needs help to breathe. Just think about that. A breakdown of the 47 folks in the hospital: 27 Caucasian, 11 African American, 3 of other race, and 6 are still unknown. We just haven't gotten that information from the hospitals about the demographics. Today, there have been 310 people who have recovered. That's our green curve right here. That's good. Out of this, they've obviously been released from mandatory isolation and quarantine. This is up 31 individuals from yesterday, so this is a very good day related to people in our community who have gotten better from COVID-19. We're very happy about that. So a status check overall, we have 598 positive cases. So a positive case is someone who over the last month has gotten sick with COVID-19. Now we've had many who have recovered. They're still in this 598 number. And we're presently monitoring 271 active cases. This is down from 12 yesterday. So this is our yellow curve here. The green curve is slightly went higher than the yellow curve. The yellow curve from here has went down and is flattened. Now it's starting to head down for today. We'll see if that's an ongoing trend. But certainly this is what we've talked about. With the data, we need the green curve to go north, we need the yellow curve to go south, and we need the red curve to flatten out, which it has not yet done at this point. From total cases, 324 are female, 274 are male, 16 are under 19 years of age, 117 are in their 20s, 83 in their 30s, 98 in their 40s, 111 in their 50s, 85 in their 60s, 45 in their 70s, 30 in their 80s, and 13 in their 90s. 22% of our cases are under 30 years of age. 36% of our cases are under 40 years of age. 53% are under 50. 71% are under 60. And 29% of our cases are over 60 years of age. Breakdown by municipality. City of Syracuse, 244. Town of Clay, 64. Town of Manlius, 43. Town of Salina, 35. Town of DeWitt, 33. Town of Camillus, 32. Town of Onondaga, 28. Town of Cicero, 26. Town of Geddes, 20. Town of Lysander, 18. Town of Pompey, 19. Town of Skaneateles, 13. Town of Marcellus, 4. Town of Atisco, 4. Town of Van Buren, 4. Town of Lafayette, 3. Town of Elbridge, 2. Town of Fabius, 2. Town of Spafford, 2. And Town of Tully, 2. So geographically, we've had the virus in every town, north, south, east, and west. Every county around us has had the virus. We're all connected. in central New York. So we need to be diligent. We need to watch our health. We need to take our temperatures. We need to be cognizant of our health each day as we wake up and if we're entering the public. Testing. There have been 7,839 tests administered in the county. 7,705 tests have returned with 593 positive results and 7,107 negative results. Again, there's standards on testing. You need to meet certain standards set by the CDC and the New York State Department of Health. 7,107 people met the merits to get tested by those standards, but were sick with something else. So it's just a remarkable number to think about that. We have 134 pending tests. Essentially, we're pretty much in real time. We have 209 tests that are back since yesterday. So if you think about it, we had about the same number of pending tests yesterday. We essentially received those tests back and an additional 60 to 70 that were actually done yesterday. So we're seeing the turn times better. Why is that critical to all of this? It's critical to where we are today, but also down the road in the future. This allows our health department to box the virus in really real time. We get to get the results of a test in real time. We essentially then get to isolate the individual, investigate, and then quarantine. This is going to be critical as we move forward and we live with this virus. 7.8% of those tested are positive. Yesterday we announced the priority testing for our nursing home personnel at the Walmart testing site. As we get more capacity, we're going to do more proactive things with testing related to protecting our communities vulnerable. And eventually that may be part of a phased-in restart depending on what capacity looks like. So we get more testing capacity at Walmart. We talked to Walmart, we talked to Quest. We want to thank them for working with us so that we can get our nursing home professionals testing right now. Why is that important? It's important because we've had community spread. Our nursing home professionals go home. They have to go out to the grocery store. Some of them may be asymptomatic with this. They may go into a very dense population, and then that may spread. And so we want to be on the front edge of this. So again, we want to thank our partners there. I know many of our nursing homes are actually incentivizing their employees to go. I think I heard about one case where one nursing home was giving out gift cards to go and do this. This is something that is critical to be proactive to protect our communities vulnerable, and certainly individuals in nursing homes need our help. Happy that we're going to, after looking at all the data, the national data, that shows many of our seniors are hit harder by this virus. We knew this was going to happen. So we're going to continue our proactive testing with our seniors. We're going to next week start out new testing with seniors in assisted living and independent living facilities and senior apartments. Again, we're going to be actively going and testing employees working with our senior populations, but we're also going to offer testing for seniors. How are we going to do this? We're going to have two ways. Our Triage testing site at the Syracuse Community Health Center is going to help us with testing for assisted living and actually independent living and senior apartments. And our partners at Essentia Health are going to work with us, and we're going to go into our assisted living senior centers, and we're going to go right to the seniors who aren't mobile, and we're going to test. We're going to test the employees. By doing this, we're going to save lives, and that's what this is all about: is saving lives. Okay. When we have resources, we'll do more with testing. Right now, we don't have hundreds of thousands or tens of thousands of tests, but we have the resources to go and do this in populations where we see this virus really preying on our seniors. So we're going to do everything we can to save every life that we can. Process after the positive test. Again, you're going to hear from our health department. You'll hear from your doctor. We're going to check on your symptoms. We're going to then begin an investigation into direct contacts that you have had since you've been symptomatic, potentially even the days before you had symptoms. Based off of this investigation, we will then quarantine individuals. Again, we talk about this every day, but if you're watching for the first time, just because you work at a business that has had someone test positive doesn't mean you were in direct contact. Take my building and county government, for example. We've had people, employees of ours, we have almost 4,000 employees that have tested positive. That does not mean I was in direct contact with them. That does not mean that I need to be in a quarantine. So that's how that works. Again, when it comes to recoveries or releasing folks from quarantine, our health department is the only one that can do that. I know some of you have emailed me. You're either at your date or close to your date, or you think you're ready to be released from a quarantine. When you email me, I get those to Dr. Gupta and her team, and they're responding in real time. Right now, we have, again, almost 1,100 people in quarantine or mandatory isolation. That's a lot of work that they have to work through. So they're getting to you. They had a very good, productive day with recoveries over the last 24 hours, but bear with us. Thank you, especially everybody in a quarantine that's not symptomatic, that feels good. You are part of the solution, and really, I want to thank you personally for working with our health department. Our voluntary shelter in place, it's easier to change up your commercial spending when you're looking outside and there's snow squalls in April, so we want to thank Mother Nature for that. But again, let's hang tough here. Everything we are doing to drive data now by staying away from each other will give us better results and will give people more time to heal so that we see that reflected in these curves. So hopefully next week will be another good week of data. Hopefully we'll be getting people better and recovering people, and our health department will continue to be in real time. We're doing more strategic testing, so that may lead to more asymptomatic positives that we've never really been able to identify before, which will be new. But again, thank you for all of your collaboration to date. This is very tough, and it's been long, and due to the stress of why we're in this situation, the days are longer and it's harder. And I know when you're at home and you got your kids who are stressed out, and you can't see mom and dad or grandma and grandpa or an aunt or uncle, this is not easy. So again, thank you to the community. We're going to get through this. We're getting better each day. So please work with us. Let's continue to starve this virus for the next week here. And certainly there's state and federal orders in addition to ours, but this is a strategic initiative that we had to help drive our own data. I want to talk about a restart and what our ideas are about that. And I know everybody heard about the federal government giving some guidance to states having autonomy on this issue within their jurisdiction. And I know there's been conversations with the state and with the governor. I think the governor has referenced a few times that New York State's diverse. We've been impacted differently by this virus, and we need to look at this potentially by regions. We agree with the governor. We believe that Central New York as a region should be looked at on its own merits based off of health data. So in conjunction with other county leaders, I've been speaking to County Executive Pacenti in Oneida County. We've spoken to Herkimer County officials, Cayuga County officials, Oswego County officials, Madison County officials, and we'll be inviting Cortland County officials. And then our respective cities, Utica and Syracuse and Oswego, certainly Auburn and Fulton. We are going to work together on a Central New York restart plan. This is different than what we talked about with our Economic Resiliency Task Force, because that task force is going to focus on economic recovery. What we're talking about is coordinating a restart strategy. and when we restart certain things, and we roll them out based off of data. This would require coordination with our health commissioners, coordination with our hospitals, coordination with our emergency management department, coordination with economic development, potential coordination with schools. And the idea being no matter what this is, it's a phased-in approach. It doesn't get to a certain date and we just send everybody out to work. Why? Because if the virus comes back, our health department needs to be in a position to respond in real time. So whatever a restart is, it's going to be phased in. We will work with New York State. We'll take this plan, and if the data merits that Central New York should be treated differently on a timeline that's different from what the state has said, we will go to the governor and say, Governor, this is why we think Central New York should be treated differently, and why as Central New York as a region can start their phase in now. Now, that may not be the case. You heard the governor. The governor has put a May 15th date out there. I'm sure, and he's alluded to the fact that he doesn't know if that's the date for the whole state to begin to operate business. We don't know if our date is May 1st, May 15th, or a different date. The health data will determine that. But what we do know is that we think Central New York as a region should be treated as a region. We agree that we are all connected. There's interconnections, just like New York State is with other states. So we're going to work on a plan. We're going to present the plan to the state. And then when do you implement that plan? We implement that plan when the data merits that our public health department agrees that they have the ability to deal with this threat in real time. So we're not there now. We don't have our plan done, but we do agree that Central New York can be looked at as a region in this process. Looking at a couple other things here before taking questions. Upstate Triage Hotline, 315-464-3979. This is a hotline you call if your primary care provider can't do testing. They can refer you here. You call if you don't have health insurance, you're sick, you want to get screened for COVID. Medical professionals will screen you. You then go to our triage site at the Syracuse Community Health Center and you get tested. Our seniors, healthcare workers, and adult nutrition line, 315-218-1987. This is a line if you find yourself in need of a meal or you can't get to the grocery store, toiletries, you're staying home because you're following all the rules, you're uncomfortable, you have medical conditions, call this line. We have volunteers that are there and willing to help and have been helping hundreds and thousands of our residents every day. Child Care Solutions, 315-446-1220. Again, this is our daycare program for essential business employees. We don't want grandma and grandpa being daycare if you run into a jam. We want you to utilize these daycare slots free of charge. For the month of April, call Child Care Solutions. They will help coordinate those daycare efforts for you. 211 for social and emotional support. We have mental health professionals who are there to help you in what is unprecedented times, and all of our mental health is being challenged every day. You're not in this alone. If you need help, please contact 211, and they can give you strategies, make referrals as needed. But again, this is nothing to be ashamed of. Everybody is being challenged with their mental health. Vera House Support Line, 315-468-3260. There is never any excuse for abuse. If you're in a situation where you're concerned, you have fears, you have questions, please contact Vera House. Again, 315-468-3260. New York State Children and Abuse Hotline. If you're reporting a situation of child abuse, 800-342-3720. Again, McMahon Ryan Child Advocacy Site is here in Central New York. They're not really, that's not where you essentially report the abuse, but they can help you through that process. Donations of PPE, 315-435-2525. This is emergency medical equipment that You can donate if you run into the masks or gowns that you've had at your business, and you have some extra ones you want to give them to us for emergency management. We'll get them out to the nursing homes, we'll get them out to the hospitals, to the ambulance workers, the volunteer firefighters. Saying that, I will take some questions.
Ryan, on the subject of Restart, it was almost 2 weeks ago now that you implemented the alternate day social distancing and asked the golf courses to close. Come Sunday, what are you going to do with that? Are you going to extend those?
Yeah. I don't know. I'm not sure, Tim. I think we're going to take a look at it. I think there's been some other related to golf courses. Governor Cuomo shut them down statewide, so my executive order is essentially null and void from that. Our voluntary shelter in place is unique to our county. We'll talk with everybody. We'll review the data. Out of our positive cases this week, about 20% of them were from affiliated cases, where the randomness of the spread is not there. And via affiliated cases, you can potentially implement new strategies to help stop that specific spread. So what we'll be looking to see is if our positive numbers that are not affiliated related, if they continue to go down, because that's really the way you look at community spread. If you have an affiliation where you had one situation that impacted 8 or 9 people, that's not a true indicator of community spread.
Okay, and more broadly, what's your timetable for producing the regional restart plan?
Well, we're going to start. We've already been working on this. We're going to, just like we plan and prepared for COVID, you plan and prepare for what a restart looks like with the consultation of your health professionals, that you do it in a way that does not put the public health at risk, and you do it in a way where the gains you've made don't evaporate. So we are going to take this framework that we've been working on, talk to all of our other counties, talk to the cities within the counties, and put together a document that we can show to the state, and then come up with metrics with our health departments on at what point do they think they can fight this virus in real time. And that's part of this. So the good news, if you want to start the economy and you say we're different from New York City and Long Island, we agree with you. We are. We have not been impacted like my friend Steve Ballone in Suffolk County, or New York City, or my friend Steve Newhouse in Orange County. We should not be held to a higher standard of a restart if we have hundreds of cases or thousands of cases as a region when another part of the state has tens of thousands of cases. So that's the good news if your position is we got to get going. Here's the bad news. Our health data today does not merit a restart. We need it to improve. So for those of people who are saying you can't restart, don't restart, don't restart, there's the good news for you, is we agree that this is positive, but that is not good enough. So we're going to look at this data. We're going to take all of our data as a region and look at our regional data as well, and then we need to build up a plan that works, and then we need to have our health departments in a position that whenever you restart phase 1, and phase 1 may be very small, that we can respond in real time with rapid testing, quick investigations, quick quarantines, because that's going to be life.
Have you designated a chair or a leader for this?
Right now, it's being done at the executive level within each county, and we probably, after we have the initial plan, then the rollout comes. We'll probably have an executive committee to help with the rollout with that. But we're very happy that we work together a lot as counties in different ways. Now this virus is forcing us to work together in ways we never thought we would. And we're all going to be stronger after this because we're all going to be not that we're being forced to, it's probably the wrong word. We want to work together, but this virus is putting us in a situation where we never thought we would be doing emergency management conversations, health department conversations like this together. So we're a region. You may live in Madison County and work in Oneida, or live in Oneida and work in Onondaga. That means if you have the virus, you can spread it to any of our counties. So we have to have coordinated efforts, and we all have to be ready for when a positive case shows its head, that we can quickly attack it.
I also had questions about the structure of this. Right now, though, it's either the county executive or the chairman of the Board of Supervisors based on governments.
Yeah.
It's you guys having this committee, and then how will you have conversations just, electronically? And then it sounds like at some point you'll bring in maybe health commissioners?
Well, the health commissioners work for us. And so,
Talking on this committee specifically.
yeah, we'll have our health commissioners talking to each other. And so our emergency management commissioners will be talking to each other separate. We need to figure out strategic benchmarks for strategic economic sectors and strategic hypothetical timelines. And then once you can agree to those, and then your medical teams can agree to those, your health department, then what are the benchmarks that the health departments feel comfortable with that they can meet the challenge? What is the number? What is the number of active cases where our health department is confident that by putting more people back into the workplace, they can meet their challenges? And then the third piece of that is we need the state to buy into it. Okay? People have questioned, I've gotten that question. My understanding is that the governor will make the decision if he's going to allow regional restarts. We believe we should have a regional restart. We don't know when that is. If our health data, the opposite could be true. If the governor is saying, I think May 15th everybody should go, but our health data hasn't gotten to the point where we think it should be, we could be saying we're not ready, right? I don't think that's going to be the case. We're in better shape than many other communities, but we're not out of the woods yet. This needs to get better. This yellow curve needs to be coming down.
What kind of conversations have you had with the state about something like this?
I've had conversations with the executive chamber. I haven't spoken to the governor directly throughout this process, but through his team, they've had great communication. And, we talked about a regional restart. We talk about when we see problems in Onondaga County, if they're not our responsibility, but we see a problem, we want to help be a partner. You look at our county, what we've done and what we're willing to do for anybody in New York State throughout this process. Our hospitals have led, our governments have led, our residents have led. So they're aware that the idea, and the state does this too. The state has regional economic development councils. Why do they do that? Because each economy is different, and you need to have a regional approach. When we're talking about a regional economic restart, it's very consistent with what the state has already done in this space.
How do you envision this logistically working? Conversations over like a Zoom app once a week? I'm just curious.
Yeah, I talk to Tony Pacenti every day. I talk to Ben Walsh every day. We're talking to other counties every day. The Cayuga County chair and Oswego County chairs and Billy Barlow and I, we're talking weekly. So we'll probably do a Zoom meeting, right, just from a time standpoint. We could all get in a room like this and be 6 feet away from each other. But, yeah, we'll probably get on a Zoom meeting or a conference call, develop a document, a living, breathing document that we all customize to our counties and what's different in our region. Each county's a little different. We're all the same, but we all have different niches that we're better at, and so that will want to be represented. But I think this is how you do it. You don't do it with 57 counties saying to the governor of the state of New York, let my county go this or that or whatnot. You do it as a region. We're all connected. Our economies are connected, and you build a plan. And when that plan goes is when our health departments say, we can handle this in real time.
How soon would you like that first meeting to happen?
Oh, it's going to happen soon. It's going to happen soon.
Next week?
Yeah, yeah.
The governor's executive order requiring masks goes into effect tonight. What's your guidance for essential businesses here on enforcing that?
Well, you need to wear a mask. That's the order. You should be wearing a mask. We've been saying that for a long time. Or you got to wear a facial protective. If you don't have a mask, I think bandanas might even fly. Remember those? So they should. It inspires business confidence in your customers when your employees are wearing masks. If it inspires confidence in the community when your fellow citizens are wearing a mask, and it's worked in other countries by wearing a mask. So that's why they're doing it. The enforcement of that is going to be a challenge. I don't know if businesses will enforce it themselves, or certainly we don't have hundreds of law enforcement agencies sitting at retail stores looking to give out tickets. There's just not, it's just not enough people to do that. So the enforcement is always challenging with rules and regulations that you never thought you would have to enforce in daily life. So the reality is we need the public to step up and do what's best for their public health. Your health is your greatest asset, and this is good for your health. So please do it.
Today, Madison County said that businesses can turn people away if they're not wearing a face covering. Do you say that businesses can do that here as well?
I haven't seen if they did it in order or not, but that's their business. That the law is the law now. So certainly they have the right, if someone's breaking the law going into their business, to say, go do that. I don't know if Madison County is giving interpretation of what the existing executive order is, or if they did their own order. But certainly that's common sense to me. If you own a store, you see someone walking in without the mask, Governor Cuomo said you have to wear a mask. You think that's bad for your business because they're breaking a new regulation. Certainly you don't need to have them in your business.
What would you say to somebody who's looking for a mask and not wanting to do arts and crafts time at home?
They're very hard to buy in mass quantities. We have looked at trying to buy lots of them to be able to give to people when they don't have them. At this point, we have not been successful. So I think you try to do it, and certainly you're going to have to do some sort of facial covering to be compliant with the governor's order now. So whether it's a scarf or a bandana, a mask, we're all going to look very funny in all this. And now I think the first few days people were wearing masks. They were a little cognizant of how do I look. Now I think everybody's kind of used to it. And some people have really cool masks. So I think everybody's got to do it. And if we can get our hands on a bunch of them, where we have thousands of them, we'll give them away so that people have them. But we have not been able to do that. It's very hard to get these masks.
Ryan, can you talk a little bit more about your plan for testing people in senior residences?
Yeah.
Is the idea that you would test asymptomatic residents and employees?
Yep. So
what are the numbers that you're thinking about?
So we're going to look at and go into locations that may have had an employee or a resident test positive. And so we're going to go into those facilities and test the employees and the residents. We're doing this to try to get ahead of it so we know if there's a problem so we can save lives. Eventually, we know that these are vulnerable populations. We're going to just do that anyways as long as we have the resources to do it. So there are certain facilities, whether it's assisted living or just regular senior center apartments, nursing homes, there's been cases, right? We all know there's been cases. If there's been cases, even if you've had recoveries in that building, we now have resources. We're going to go in and be proactive and do that. We're going to come to you with our partner in Essentia Health. If you have the ability to, if you work at a nursing home, we're going to ask you to go to the Walmart site. If you work in, if you live in another senior independent senior facility, we're going to ask you to go down to the Triage site at Syracuse Community Health Center. And our adult and long-term care teams are coordinating with these buildings and working to get the information to the residents.
Many of whom probably don't drive, right? How are
Many of them don't. Our independent living facilities, they do. So that's why we have them going to the Triage site. And Essentia Health will go directly to the facilities where people don't drive. And certainly our nursing home employees all have transportation. And if there's people that don't have transportation and they're going to fall in these categories, we'll get somebody there and we'll get you a test.
This starts next Monday?
Yep. We're coordinating these efforts now, and we'll be starting these next week. Yep.
Do you have an idea of how many people you'll be able to test in a day or a week? Or
Depending on, we will be testing up to 1,000 people next week. If that's the numbers, we have some capacity with testing. But I think the specifics, I can't even get into the specifics. I don't even know how many are at each facility as far as residents and or employees. But we have some capacity now. We want to take advantage of that capacity, being proactive, identifying a problem before there is one, whether it's asymptomatic in somebody, because we know in these populations, if they get hospitalized, they get very sick. And so we're going to do this, and we're in a fight. We're taking the fight to COVID-19 with our senior populations now.
Where do you get the test kits from now? That was a big struggle a few weeks
Yep.
ago.
Yeah, we work with different labs and different partners, and we at times procure our own, and at times the state, when they have some of the PPE delivery, sometimes the state gives us some testing kits as well. So it's a hodgepodge of procurement efforts and new laboratories that are coming in or have some capacity, and so we'll take advantage of whatever we got.
Were you able to clarify the number of deaths associated with nursing homes?
No, because we're waiting on various definitions. I don't know what a definition is. If someone, what are you looking for? If a nursing home is where someone lives. Are you looking for, did they die where they live, or did they go to the hospital and pass away in the hospital? So there's various people are using various definitions now in this, and the state's working on getting data out now. So we're waiting we want to give the same definition that New York State's giving, and we'll share that. But certainly there's people who lived at a nursing home, but they passed away in a hospital.
And is that 2 that you're referring to?
I know we had at least one of our 5 residents that we lost yesterday
And
was
the state had reported one before that.
at least lived at a nursing home. I've been
And
told.
are there differences on nursing homes, assisted living? There's a lot of different terms that could make this confusing.
Yeah, so nursing homes are specifically fall under the New York State Health Department regulatory guidance. Our health department we have broader authority related to assisted living facilities. They fall under your local health departments. So our ability to do things in this fight, we have more independence in our approach with assisted living facilities, whereas nursing homes fall under New York State. Any proactive approaches we want to do, we need state approval in related to those.
Has the state approved you going in and testing those nursing home residents that are asymptomatic?
We're not testing residents right now in nursing homes. We're focusing in on the employees in nursing homes and offering the employees testing.
So the seniors next week, they'll be at assisted living.
Assisted
senior
living
not at nursing
and independent,
homes.
Yep.
It'll be based on where there are already cases.
Correct. That's where we'll start. We're going to get to everybody deeming that we have testing capacity.
And what's your status of the Walmart testing site?
I read they did some tests today, or at least we're out there. I think over the weekend we have people that are signed up to go there, and so looks like they're ready to go. They were always going to phase it in, right? They're going to go, I think, 25, 50, 100, 150, and potentially more than 150 a day at some point. So it's new capacity. We're happy with that. They've agreed to work with us, which is what we need to do. Anybody who wants to come in. I had another lab email me saying they potentially have some more capacity okay, let's plug you into the plan and let's get you working, you know, and so we can continue to react in real time and be proactive where we can.
Brian, a little change of direction. Is the county going to move forward with bonding for the STEAM school, or has coronavirus thrown the bond market into too much disarray?
We are going to have legislation before the county legislature in short order related to the STEAM school. So the STEAM school is a priority. It's one of the priorities we talked about in our State of the County address. Part of this, balancing this, is we still got a agenda that we need to still get through. And by getting through the strategic elements of our agenda that was before pre-COVID-19 pandemic, we will help get our economy back in a better position. So certainly the STEAM school, regional school, focused in on the strategic areas where our employers are demanding workforce talent. That's critical in the process of a recovery. In addition to that, we're talking about a $72 million construction project. We're going to put a lot of people to work.
So that legislation would be to authorize the bonding,
Authorize the bonding and the lease with the city school district.
and that'll be next month? Or?
We're preparing to get that over to the legislature for their consideration this month, and I know Chairman Knapp's probably watching this right now, and I know Chairman Knapp's going to shepherd that process through, and I'm sure we're going to get a unanimous vote out of the county legislature. Thanks for asking that question. I enjoyed that.
What's the favorite mask you've seen so far?
There's some good ones floating out there. My team's getting very creative with some of the masks. I heard that there might be somebody working for a 3-year-old police mask for Andrew McMahon. Officer McMahon would love to have that as he chases the social distancing bandits in the neighborhood. So there's a lot of good creativity here, and everybody should have fun with that. I think the mayor's got a mask challenge going on right now. So I have not participated yet, but everybody's seen mine every day.
Maybe an Onondaga County emergency management mask?
Yeah, Commissioner
To
Weirs,
match your
where are you?
jacket?
Yeah, we'll get him in one of those.
Brian, the hospitals have been hit by this in ways that maybe weren't quite anticipated. We were worried that they'd be overrun
Yeah.
with patients. The problem is maybe they have too few. But they have problems, I guess, securing PPE. Some of them are furloughing hundreds of employees. What can be done about that? What's the source of, how are we going to get this PPE into the community?
I think that's, to your point, when we've talked to, and we've asked our health department to give us in their opinion, a phased-in elective surgery process, what elective surgeries could start tomorrow if there was PPE, and we're working on that. For the most part, most electives could start, and some of the surgeries you may want to hold off on because they are more intensive and the risk to spread is a little bit more. But for the most part, everybody's in my inbox, a lot of people have been screaming about hospitals. The worst models have not come true. You got to get these people working again. I feel that. I would make the case today to the governor and that you need to let these hospitals start their elective surgeries. You need to let people who need to go to the eye doctor, go to the eye doctor, the dentist, but you need to have PPE. That's the challenge now. It's not the will or the state of these are essential businesses today. You're just loosening up regulations on them. And so that's not part of a restart. That's just loosening up regulations. But the challenge is that the PPE is not there. And you still need that PPE that you would use in the surgery room. You need that right now for the COVID patients, for all of our patients in hospitals, not just our county, but all the counties. So we're on calls. Our emergency management team is on calls with the EM teams in the hospitals. We need to establish at what point, what reserves, is it weeks, is it a month, can we start elective surgeries again, and what are those surgeries? And we go to the state and say, let's allow this, let's loosen that regulation.
And are you out in the market trying to buy, or is the state coordinating the buying, or is there help from the federal?
Everybody's still doing it. So you have the hospitals are trying to purchase for themselves. We're trying to purchase to complement what the hospitals are doing in the nursing homes and first responders, and then we have grocery stores now wanting it. We have people wanting it as you have new regs. And the state obviously is in the same boat. So I think related to getting the elective surgeries back going, and I want them to get back going. This isn't a restart. This is loosening a regulation. Only reason we needed that regulation is because we need to free up beds. We freed up the beds. We have too many beds open now. We can start this again, but we got to get the PPE. I think that has to land the hospitals first. They have to go out trying to buy these massive orders to get that in, and if they get some of it intercepted, and then we can have a conversation. We need to complement and supplement for the COVID-related response with the hospitals. But that's something that right now, if we can get this PPE, some of these workers who've been furloughed can get back to work.
But it's still the Wild West. You're
It is.
competing with
Everybody.
everybody, and shipments could be intercepted by FEMA or...
Yeah, we have essentially the pecking order goes federal, then states, and then we're okay. So finding the supply chains, getting the supply chains, having the supply chains actually be what you ordered, and now COVID has started to move across the country. So there's other communities being hit hard. They're experiencing the same things we've been experiencing. There's more competition now than there ever has been.
This is still a big focus of the EOC folks?
Yes.
In your conversations with nursing homes, assisted living facilities, that category, did they have a cohesive plan about how they're communicating with residents and the residents' families when cases do pop up?
So that has not fallen under our regulatory authority. I know that the governor has an executive order now that essentially, I believe it says, if you have a positive case in your building, you need to let the families of the residents know. So again, Andrew, this is not my lane. I have a problem in my county in this lane. I have offered our services to get in this lane with the state. Our health department and their local departments are working together. We find the problem is asymptomatic people may come in, workers may come in, they're not symptomatic, they get somebody sick, next thing you know you got a problem, right? So what are we doing? We're getting testing capacity, getting the workers to get testing, and so that we can identify risks. What happens then if you have workforce shortages? We've said we're willing to go bring on some of these employees who have been laid off, and we're willing to bring some of them on and then go put them in to help nursing homes complement their staffing situations. We will do what we need to do to save lives.
The hospitals, again, besides being important to our health, they're an anchor, obviously, of the Syracuse economy. And one of the things they do is sponsor public amenities like the AMP and the War Memorial. Have the hospitals asked to back off on those sponsor payments?
I've not heard that. Hopefully you're not breaking news to me, Tim. But I've not heard that. I think we have the St. Joseph's Health Amphitheater, and we have the Upstate Medical Arena at the War Memorial. So certainly Dr. Corona has not called me on any of that, and I would probably not take that call at this point. So
I mean, it's possible nobody will be able to attend.
Yeah, I think these are all things that may be post-COVID emergency conversations, but certainly we're doing what we can to help out the hospitals. The county government's going to be paying $2.2 million into a fund for hospitals that we've never had to pay via our friends at the state legislature and the state budget. So we're going to be putting money in that we've never had to for hospitals. Certainly we would hope they would maintain their contracts with their partners. Other questions? Okay, I want to thank, today would have been opening day. For those of you who remember last year's opening day, I threw out the first pitch. It was a strike. It was probably 80 to 90 miles per hour right down the middle. They tried to get me to put on a uniform right after, but it's not opening day. And so the Syracuse Mets today started, and they delivered lunch to our health department and the Triage testing site community health center staff today. Jason Smorrell and Jeff Wilpon of the Mets, thank you for that. We cannot wait to see the Mets playing baseball again. A reminder, we've been making some improvements at MBT Bank Stadium. We cannot wait till we're in a position to play ball. To get there faster, help me starve this virus, stay home, be smart, be safe. And in this process, there's going to be days where we get knocked down, but we always get back up, and we fight together. So stay safe.